RSV is a common respiratory virus that typically goes away on its own in a week or two, but it can cause more severe infections for younger children and older adults. Joining us to talk about the symptoms and when you should seek treatment, we welcome the medical director of the pediatric ICU at Rocky Mountain Hospital for Children, Dr. Danielle Dhaliwal. Dr. Dhaliwal, thank you for joining me today.
Of course.
I'm sure you got a busy day ahead, so we appreciate you taking the time out right now. First, let's break down what are the symptoms of RSV if we're not familiar.
It can start as kind of a common cold. So usually you see a lot of upper respiratory symptoms at first: congestion, cough, runny nose, fever. And then in some kids, the more vulnerable population, it can progress into lower respiratory infections that can be more significant.
Can it be hard to diagnose, because it might present more similar to a cold, maybe kind of seem like a bronchitis or something like that? So can it be a little bit tough to diagnose at first?
It can be tough to differentiate from infections from other viruses, for sure. It does have a higher rate of hospitalization than other infections. So if you are seeing little babies with trouble breathing, more significant cough, difficulty feeding, that would be a reason to bring them in to seek care.
And that is scary, and that kind of leads us into our next question, why it can be so much more dangerous for young children and babies and older adults specifically.
Specifically in young babies, they just have smaller airways, and RSV can cause a lot of secretions that can plug up those airways. They also breathe through their nose, and so when their nose gets really congested and clogged, they can really have trouble breathing. And in the older population, they're just more vulnerable and more likely to get sick enough to need to come into the hospital for oxygen or treatment.
So Dr. Dhaliwal, we notice like our baby is suffering a little bit at home. When is that line that we should come in and come see the doctor?
If you notice that your baby's having any trouble breathing, so we usually look to see if they're using their belly to breathe, using muscles to breathe, breathing really fast or labored. That would be a reason to come in. If babies are having trouble feeding and they're looking like they're going to get dehydrated, that would be another reason to come seek care in the hospital.
When should the conversation of vaccine for RSV be started as well?
It can be started even before the babies are born. So there's really great options available in the past few years that we've never had before to really protect the vulnerable populations. So there's immunization that can be offered to moms when they're pregnant to provide passive immunity to babies, which is really amazing. They're protected as soon as they're born. And if that's not available, there are options for babies as well, which is more widely available than it has been in the past with our new options. And then there's also immunizations and vaccines for the older population, so you can protect your whole family from multiple different angles.
Amazing. Well, thank you so much for coming in today. We so appreciate you.